Okay, honorable members, we reconvene again to take another presentation from the Pharmacy Council. Welcome to Pharmacy Council. I must apologize initially that there's a hand I did not recognize of one honorable member, Honorable Dr. Jacobs. I also was getting involved in looking and glued into the presentation. As this is a presentation, some of us have not been able to read well and maybe want to remind ourselves as we saw it on the notes. But let me request honorable members, there are three ways of raising your hand. It's one through our WhatsApp group, number two, raising a hand on the platform like Honorable Dr. Jacob's hand is still up here now, and number three, telling me right now over the sort of the platform here. May I say for now, because of this way of also not really able to check everything, may I rely lastly on the ones that I'm going to call. If members can indicate, raising a hand here on the platform is well and good, I may see it, but can we just for today assist me that I also would want to recognize you telling me so that I can get all hands. That's how I missed out, and I'm sorry for that. So as we are now going to be getting the Pharmacy Council presentation, I would really plead that you raise your hand. I'll give you a time at the end, then I'll take the names down. I may not be looking into my WhatsApp group for now, because one is hooked up to looking at this. I hope that members will not take that as a disregard, but just for today, because this presentation is also something one has not been looking into recently. Welcome to the leadership of this Pharmacy Council. I'm not sure who is there. If you do indicate who you are, you then introduce your team, but if you could also show your video as you present, that would be greatly assisting us so that you can know who's talking. Let me now give that opportunity to yourself, and then we will give you the allocated time of about, I don't know, I can't remember, I'll check. By the time Ms. Machalamba will just indicate to me, by the way, how much time we give each presenter. But while we are doing that, while she's checking that, she'll come back to me or to you. Let us get you to introduce your delegation. Thank you.
Thank you very much, Chairperson. My name is Mogolo Pasha. I am the president of the South African Pharmacy Council. And with me, I have Mr. Vincent Tlala. And Mr. Vincent Tlala is the registrar or the CEO of the Pharmacy Council. And also Ms. Mojo Mokwena. I think Mojo has joined us also, yes. So Mojo is the COO of the South African Pharmacy Council. So the three of us will be taking you through the presentation which we have for you this morning. Chair.
Okay, thanks very much, Mr. Pasha. Ms. Machalamba, how much time do we allocate for the presenters?
5 minutes.
20 minutes.
45 minutes.
Yes.
It's 45 minutes, Chair.
With discussion or without discussion?
It's 45 minutes for the presentation, then 30 minutes for the discussions.
Okay. Honorable, so Mr. Pasha, the president of the Pharmacy Council, you can then start or delegate whoever is going to lead their presentation. Thanks.
Thank you very much, Chair. My colleague Vincent will do, I will just make the introduction, and my colleague Vincent will take through the entire or the rest of the presentation. This is the present, yes. So Vincent, if we may just start on slide number 3. Yeah, I think mine is just to introduce the Pharmacy Council and to just appraise the members of the Portfolio Committee about the South African Pharmacy Council. And key to that is more the objects which we wish to share with you. And the first one on the objects is to assist the promotion of health of the population in the Republic. And the second one, to advise the Minister of Health or any other person on any matter relating to pharmacy. So when any other person is being explained or expanded, it actually leads to the portfolio committee, parliament, and anybody else comes under that part. So we are having that responsibility also. The third one is to promote the provisions of pharmaceutical care, which complies with universal norms and the values in both the public and the private sector, with the goal of achieving definitive therapeutic outcomes for the health and quality of life of a patient. And the last one is to uphold and safeguard the rights of the general public to universally acceptable standards of pharmacy practice in both the public and the private sector. And lastly, our mission is to promote universal health coverage by ensuring excellent and sustainable patient-centered pharmaceutical services by developing, enhancing, and upholding acceptable norms and standards in all spheres of pharmacy. So our mission also already talks to universal health coverage, which we believe that is a very important part of promoting the health of the nation. I will leave it from there and ask Mr. Tlala to take the discussion forward or the presentation forward. And Mr. Tlala.
Thanks, Dr. Pasha, and thanks, Chair. I think it is important that I highlight that as a pharmacy council, our job is to register pharmacists, pharmacy support personnel, pharmacy owners, and the pharmacy premises, which are facilities. So it is important that I highlight this at an onset because it's going to talk to the issues of the definitions as provided in the bill itself. Also, we are required in terms of the Medicines Act to look at the issues relating to the permits for pharmacy support, for pharmacists and also other healthcare providers. And I'm sure the minister would have briefed a portfolio committee that we are working closely with the department in terms of issuing permits for COVID-19 vaccination, Chair. So that's part of our mandate, which is enshrined in terms of the Medicines Act. So part of our presentation will cover a number of issues, definitions, issues related to Chapter 7, Chapter 8, and Chapter 9, Chair, and what we must say. So from our side, Chair, we wanted to look at the definition of the healthcare service provider as currently is in the bill. It refers there to a natural or a juristic person. So we felt maybe we needed to highlight that when it comes to Pharmacy Council, one, in terms of these natural persons, we register pharmacists, pharmacy support personnel, which are now the pharmacist assistant and pharmacy technician. We also register persons such as pharmacy owners. And pharmacy owners may also be juristic persons, which are companies and CCs, Chair. So it's important that we highlight that. The other thing that maybe other statutory councils do not do is we do register facilities, which is pharmacy premises. So on that definition of the natural and juristic person, it will include the pharmacy premises, which might be owned by a juristic person or a natural person. So we thought it's important that we bring it to the attention of the committee. We've also looked at the definition as provided in the bill of the health goods or health-related products. I think what we thought we should bring to the attention of the committee It's where it refers to any other committee other than the orthodox medicines. And we believe there is no definition, Chair, of the orthodox medicines. Rather, we would request that the committee stick to the definition of medicines, because the Medicines and Related Substances Act provide for the definition of what is a medicine. There is no definition of orthodox medicine. And we want to run away from orthodox medicines because it might present a discriminatory approach, because medicines can include even traditional medicines or all other medicines. So it's critical that maybe we run away from that orthodox medicines, Chair. The other thing, Chair, that we felt in the definition where we talk about health-related products, and that's where we were talking about the exclusion of orthodox medicines. Our preference, Chair, that in terms of using terminology that is universally acceptable and also used by World Health Organization, is that we use the word health products or health goods. And we believe that it's an inclusive term. It will include medicines, vaccines, diagnostics, and medical equipment. So that definition, we are of the opinion it's much more inclusive, Chair. I think at this stage, I will hand over back to the President. And I think if you were to not accept any of the things that we are praying for you to do the changes, this is the part where we believe the act should not be published without the inclusion of the word pharmacy or pharmacist as part and parcel of the primary healthcare services. And I think the President will speak a lot about it. I'm sure members will also remember that when the President made this announcement last year in terms of the state of disaster, pharmacy, it was one of the listed businesses that will remain open. For that matter, pharmacy has never been closed even during disaster, because pharmacy is critical to primary healthcare services. So, President, if I could hand back to yourself.
Thank you very much, Dadetala. Yes, I think for us, that very important inclusion of pharmacy in the bill as it currently stands, where it does not show or talk to pharmacy in the explanation or definition of the primary health care. We believe that it will be rather a mistake, a big mistake actually, if that continues, because we believe that primary health care cannot be defined in any way without mentioning and or talking to pharmacy as the core or the main part of the primary health care. So for us, on the point that was mentioned now by Mr. Tlala of the time during the alert level 1 of the lockdown, 5 of the lockdown, that when it was introduced last year, we would know that pharmacy being this key important part for primary health care was indeed the very first one, which was mentioned as to continue trading or opening, to continue servicing the population in terms of the first point of call for medicine. So we would also know that over the years, pharmacy became known. We will of course know from our history of the country that pharmacies themselves were not there were not many pharmacies in the rural areas, and that to some extent has probably have led to people see pharmacy as not part of the primary healthcare system. But when you see pharmacies really proliferating in the country today, you will realize that almost every township has 5, minimum 10 pharmacies in there. And those pharmacies provide a very essential service of being the first point of call for ailments and when the nation is having any discomfort health-wise. So we therefore are crying to or praying to the committee to really consider including a pharmacy directly in the definition when it relates to the primary health care.
No, thanks, President. I think, Chair, safe to say that pharmacy remains open 24 hours more in most cases around the clock, particularly even in hospitals, both public and private. And you will be aware that even on weekends, the pharmacies remains open. Maybe also to bring it to their attention, as part of the implementation of the vaccination program for phase 1B and phase 2 for COVID-19, pharmacies at the forefront in terms of making available those vaccinations. I can safely say, Chair, that to date we have accredited 580 pharmacies that will be participating as part of vaccination. And as we get towards phase 3, we should be close to 1,000 or so that will assist with vaccination, not only with regard to COVID-19. As you are aware, Chair, normally when winter comes, we also give flu vaccine, and most pharmacies do that. So it's critical that we highlight that pharmacy and pharmacists cannot be excluded from the definition of the word primary health care. So that's our prayer, Chair, that if anything, please let's make sure that pharmacy is included there. And we are a statutory council having the clinics mostly that are accredited within the pharmacy itself. And at this stage, council has approved that general practitioners using the telemedicine system can operate in most pharmacies. And we've approved quite a few pharmacies that if a patient gets to a pharmacy and after a nurse has gone through the screening and they're of the opinion they need to be referred to a general practitioner, through telemedicine, the patient can be consulted by a general practitioner and immediately after be given the necessary medicines. So that's our request to say, Chair, include the definition pharmacy and also include the pharmacist as part and parcel of the primary healthcare definition. Chair, if I move forward in terms of our presentation, we've noticed in terms of section 5.7, the word unaccredited health establishment. We are of the opinion that it's a typo. So we request that the correct wording should be accredited health establishment, so not unaccredited. The other, Chair, that we want to bring to your attention is section 11, 1 and 4, where we talk about the identify, develop, promote, facilitate implementation of best practices in respect of fraud prevention. So we believe you could expand that to go beyond fraud prevention to look at also waste and abuse. So that then we cover a wide range of issues, because it might not necessarily be fraud, but it might be wasteful or also abusing the system. So we think those two ways will expand the way we look at issues, so that we do not have the abuse and wastage of resources. So coming to the issue of the advisory committee to be established by the minister, we are of the opinion that when such committees are established, pharmacists would form part of such committees because they are the experts in medicine. So we are of the opinion there shouldn't be any of those committees that exclude pharmacists. As we believe pharmacists are the experts in medicine, there is no any other healthcare professional who's an expert in medicine except a pharmacist. So that would be our request to say when such advisory committees are constituted, that the pharmacist is included. We again go back to the definition of the health-related products, and ours is to say that if you agree with us to have that definition of health products, then we will include medicines and medical devices and equipment. And again, our prayer is exclude the word orthodox medicine, so that we are not seen to be discriminatory. So our recommendation is that revisit the health goods and health products definition, especially in section 38. We also, Chair, are asking that when you look at section 38, the current wording provides for the Office of Health Products Procurement to facilitate cost-effective, equitable, and appropriate public procurement. So we again recommend the definition as defined by World Health Organization to say promoting of affordable and fair pricing and effective financing. So those are our requests, Chairperson, that we have sent you a detailed document as to why we believe some of those things should be changed. The other thing that we wanted to talk to, which is in section 39, Chair, is around the accreditation of service providers. In particular, Chair, here we look at the section 39 2B, which says the service provider must comply with a prescribed specific criteria. And then it includes the requirement for a range of personal healthcare service and allocation of appropriate number and mix of healthcare professionals. That's where we come again, Chair, to say, although there's no mention of pharmacy in the primary care, we would rather have this part again, clearly stating that the pharmacist should become a core component of the primary healthcare service. So without getting too much into details, Chair, that's where we will be around that subject, Chair. This is further highlighted, Chair, by the word section 37, where we're talking about contracting primary health care. So if pharmacy is excluded on the definition of primary health care services, it means pharmacists may not be contracted as such to offer universal healthcare services. So it remains critical that pharmacy should be included, because then it has impact across the whole wheelchair. So if the other thing, Chair, that I also wanted to talk to, which is again the issue of the certificate of need. Insofar as pharmacy is concerned, it's already addressed by the Pharmacy Act, because currently the Pharmacy Act in terms of section 22 gives the right to the DG to issue licenses, and in doing so they do it in conjunction with the South African Pharmacy Council. At the point a person or a pharmacy owner or prospective pharmacy owner apply for a license, we look at the need requirement. So we are already doing that aspect to say that wherever pharmacies are licensed, there must be a need. We take into account what other health establishments are there, what pharmacies are there, so that we look at the expansion of services across the country. And the President highlighted it to say prior to 1994, the concentration of pharmacies were in the urban area, the suburbs, and the inner towns. But you would see with us doing the issues of licenses, you would note that the pharmacies have now gone beyond the towns themselves into the townships and also the rural areas. So we wanted to highlight, Chair, that a large number of our community pharmacies have clinics within the pharmacies. So again, we want to emphasize we are already doing the job, and we are using technology in pharmacy in terms of offering of healthcare services. Chair, the other part of our presentation, we would leave it to yourselves to apply them, but we think we have dealt with the substantive issues, Chair. Overall, Chair, and I think the President will talk to it, we support the NHI. That's where we're coming from, and we believe it is the right approach for universal healthcare. So I can hand over back to the President, Chair, to do the completion of our thing.
Thank you, Nderetlal. Yes, I think we talked to the most important parts that we believed they needed to be highlighted. As Nderetlal indicated, a lot of the matters are dealt with in detail in our submission, but we thought we only highlight these important parts which we believe that they needed to be raised with you this morning. Yes, I think we will be happy to take a discussion at this point, Chair. Thank you.
Okay, thank you very much, President Pasha, President of Pharmacy Council. If one was following a presentation, we could tell that the CEO was making a presentation, but at a particular time, the president has to come in. I'm sure in your boardroom, you said, President, you must come in and make this point, because if it is made by you, they will hear it more. And if it's made by CEO, maybe they will dismiss me. We note your strategy. We do know, but of course, we still have to engage with the authors of this bill. Thank you very much. We would love to hear in your comments that you do have a women representation also both as board and also in the employment of Pharmacy Council. Would love to see that. Know that you don't like only Nchebe, only Beard are coming here to present. I've noted, or I also wanted just to comment in passing, it's a joke, don't take it seriously, that you must have discussed your presentation with the traditional healers, because they also feel that they don't see their names or they don't see that in the bill. So maybe you were also inspired by them or you discussed with them, I don't know. I noticed one hand, Honorable Wilson. May I take all the hands of members? Please just shout on the platform, I'll write down your name. The first one was Honorable Wilson.
Siviwe, please.
Honorable Kwahube, two.
Honorable Munyai.
Honorable Nyai, number 3. Honorable Kela, number 4.
Jacobs.
Any other? Number 5, Jacobs. Okay, do we have 5 hands? In this order, Honorable Wilson, number 1, followed by Honorable Kwahube, number 2, Honorable Munyai, number 3, and number 4, Honorable Kela. 5, Honorable Dr. Jacobs. That's where it ends. Okay, honorable members, start in that order.
Thank you, Chairperson. Again, I'm still on the road. I hope you can hear me.
Yes, we can hear you, Honorable Wilson. Thank you.
Thank you, Chairperson, and thank you for the presentation from the Pharmaceutical Council. I've got 3. One is a statement. I'm very glad that where you guys are, there's up to 5 pharmacies in a village. You certainly don't come from Limpopo, where finding a pharmacy in a village is non-existent. But I have 2 major points to raise with you. And one is that one of the primary issues on this NHI bill is that all buying will be centralized. So there's going to be a centralized purchasing system. Now, this can go a lot of ways. It can go either very well or it can go very, very badly. Because if or pharmaceutical suppliers, medical suppliers, any of those kind of suppliers are possibly put out to tender. We have a potential abuse of the system and we're going to start competitive price cutting. And I think this is going to affect the pharmaceutical industry very, very bad because it's going to become a huge restriction on a lot of your guys, a lot of your suppliers, regardless of whether it's medicines or medical supplies or even equipment. And I think that's an issue for you. I'd like to know if you've considered that. And thirdly, and I wanted to raise this with the Nurses Council as well. What you have all raised sections of the bill that you would like to see amended. You are stating that you are supporting the bill, but you are asking for amendments. I think we need to get clarity on two things. Are you supporting the bill with the amendments? And if these amendments don't carry, will you still support the bill? Thank you, Chairperson.
Honorable Kwahube.
Thank you, Chair. I want to get into almost the specifics from the Pharmacy Council. Particularly around the expansion of the provision of primary health care. I agree with you that the definition of primary health care should probably be a lot broader than it is currently in the bill. But I wanted to probe a little bit on this. I just wanted to find out how does the council envision the provision of primary health care as things stand? So under an NHI environment, are you looking to expand the provision of pharmaceutical services, understanding that we obviously now have the provision of immunizations, contraceptives, and the like? And so I would want to understand what is kind of your envisioned role as a key player in the provision of primary health care under an NHI environment, because that for me is linked to a comment that you made around the fact that, increasingly pharmacies are having footprints in rural areas and townships, and I mean perhaps that is happening, but it is very much at a very, 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 very limited scale, to the point where that's what I would kind of want to understand. If we want to expand the provision of primary health care, where are you looking to go with pharmaceutical services? What kind of sort of services are you wanting to provide under this bill, should it be passed in its current form? And then I want to also understand, you spoke about the amendments to the Medicines and Related Substances Act. What substantive changes are you looking to see made here? Because obviously one of the big things around passing a bill of this nature is that it's got a ripple effect on other pieces of legislation which would potentially need to change. And so I would like to understand, you don't need to necessarily go through a whole list, but I mean, what are some of the substantive changes that need to be made in this regard when you're looking at the amendments of the Medicines and Related Substances Act? And just to echo Honorable Wilson's point. So, I mean, you talk about wanting to have a broader footprint, but is this what you want to see under a bill of this nature? And if so, what's stopping you from doing that now, regardless of whether or not the bill is passed? Thank you very much.
Honorable Chairperson, Dr. Lomo. For me today is not the opportunity to say whether I support them or not support them. Is to listen to them and seek some clarity. The first clarity for the record, does the organization support the National Health Insurance Bill or not? Or they do not support? The second question, Honorable Chair, is the following. It's related to the issue of the pharmacists that are trying to put forward. Do the pharmacists not regard them as part of the health team? There's nowhere in the bill where the specific professional categories has been described in such a detail. Why do they want to be treated differently from other organization, professional organization, whose category has not been described in the bill? Why is there any input of Pharmaceutical Council regulating medical practitioners for practicing telemedicine in their pharmacies? Why would they want to creep in on the mandate of HPCSA, who is their role in this instance or in this regard? That would be my question. Thank you.
Okay, Honorable, I think the next one is Honorable Kela.
Thank you very much, Chairperson. Let me first welcome the presentation, but also I'm having just one question. I think Honorable Nyai has already asked whether they support the NHI, but mine will be if the Pharmacy Council support the NHI, can they please indicate to us as portfolio committee how many pharmacists you are representing? That will be my question, Chairperson. Thank you very much.
Honorable Dr. Jacobs.
Thank you, Chairperson. Good morning to everyone. I do know that the Pharmacy Council is driving a particular point home, and that is the exclusion of the pharmacists from the definition of primary health care, and that they're also driving a view on their role within the health system. I would like to ask them, and Honorable Gwagube had raised this, and I'd like to ask them, how do they see themselves playing a role still as pharmacists within the NHI program? Thank you very much.
Okay, is there any member that I've left out? None. Okay, may I get also a support and clarity? There was a decision taken because of the scarcity of pharmacists in the country, and especially in the rural areas, to expand and get another cadre of health professionals called pharmacist assistants. Can they indicate if there is any, what is the specific value add? And what is that, Honorable Dr. Jacobs?
So,
Dr. Jacobs, have you finished or have you not?
I have finished. Thank you, Chair. That was an accident that I unmuted accidentally. Thank you.
Yeah, my clarity seeking one is the value add of the pharmacy assistants in the light of the expansion of this category of healthcare professionals, because there was a noticeable scarcity all over, and therefore felt that we need to involve them. What is the value add, and where are they located? If you could remind us, vis-a-vis so many pharmacists, how many have we developed in the country, and do you still wish that this can be further expanded? Bearing in mind that most of the countries in Africa to see the issue of pharmacists being a luxury that some of them are hardly ever able to afford, and therefore have felt that adding this additional low-skilled, not low-skilled, less professional than a pharmacist is a very good value for the whole of Africa. I would just like to hear their comments in that regard. President Pasha and CEO Tlala, you can then start responding to our questions.
Thank you very much, Chair. And indeed, we have Mrs. Mukwena, who will also help in answering, so that you also realize that we are not only males. So she will help with some of the questions that have been raised. I am just going to go through a few of the questions, and my colleagues will also make their comments on the questions that were asked. Now, number one, yes, indeed, we are supporting the bill. There is no doubt in our mind that as Pharmacy Council, this is an important bill that should actually see the light of day. In fact, as soon as possible. So there was a question to say, do we support the bill with or without the amendments? I think key issue is that we support the bill with or without our amendments, but we believe that our amendments or proposed amendments, let me say, will rather enhance the bill. So we believe that it will be an enhanced bill if it is taken into consideration. But if perhaps they are not taken into consideration, we will still support the bill, but we will believe that the bill has important deficiencies that which could be addressed. The issue of the expansion of the role that the pharmacists are playing. Pharmacists are, the scope of pharmacists today has improved or increased so much when you look at what pharmacists used to do 30 years ago, 20 years ago to date. The big part is the PIT, which is the pharmacist-initiated therapy. Now, PIT is when a patient or a person walks into a pharmacy and explain the condition that they are having, and the pharmacist recommends specific medication for that person. That is the cornerstone of primary health care in terms of provision of non-complicated ailments that patients or people suffer with. There are two parts, a PMAT and PCDT, which have been and a PMAT is a new expansion, if I may call it, of the scope of the pharmacist. And PMAT includes the initiation of HIV medication, the antiretrovirals. So PMAT, when pharmacists are trained with PMAT, they are now able to initiate a therapy for people who they feel need ART. So that's a very important part in terms of the expansion and the role played by the pharmacist as it grows. I'm just going through the questions. Yes, there was a point where it was felt that pharmacists need to be treated differently or with a special care. And that is definitely not our approach nor our cry this morning. We are, and there is a mention in the bill about on the primary health care where it mentions the general practitioner and the nurse. So we were requesting that in that section where it mentions the general practitioner and the nurse, the pharmacist be added. So that's where we are talking to. So it's not that we want to be the only profession that is being mentioned in the act or anything of that sort. But the idea was to add pharmacy to that list that is already there. There was a question about Pharmacy Council encroaching on the scope of the Health Professions Council. I think the honorable member might have gotten something wrong there, because there is no level or indication or even thinking of the Pharmacy Council encroaching on the Health Professions Council scope. We work very much closely with the Health Professions Council. We are actually, right now, we've just finished, concluded a memorandum of understanding with the Health Professions Council, and that also talks to us collaborating where necessary. So there's clear delineation of responsibilities between us as a Pharmacy Council and the Health Professions Council. So there's not in any part where there is such possible encroaching on their scope. And however, I think it is important to understand that we are, as pharmacists or Pharmacy Council, the Pharmacy Act is not the only one that talks to our scope or what we do, but also the Medicines Act. So because of that, there is a reliance on the Medicines Act a lot in terms of what we do, or in terms of regulating the profession of pharmacy. There is a new cadre, Chair, called the Pharmacy Technician. And that cadre is the new level that is coming after the Pharmacist Assistant. I must say that we are still waiting for the regulations to be published by the Minister on this cadre, Pharmacy Technician. But the aim indeed was to ensure that we increase the number of people to assist the pharmacist, and those people will come with different expertise because of their training. So they are very pharmacists. It is almost impossible for a pharmacist to run a pharmacy alone or without pharmacist assistance, because of the pharmacist's work will actually end up being the work that the pharmacist is supposed to do with his or her training will actually now tend to the menial work of counting medicine and similar, which could actually be relegated to the pharmacist assistant or the technician, so that the pharmacist can continue to advise the patients and the doctors or other members of the health team that the pharmacist is working with. So we want, or we believe, that the pharmacist should rather spend time in there rather than to do other, what I can, for a lack of a better word, call manual work that happens in a pharmacy, like counting and labeling of medicine, instead of re-looking at the prescriptions and analyzing the different possible drug interactions that are on the prescription, as an example. I will leave it there and ask my colleagues to please comment on the questions.
Chair, if I could continue, I think maybe starting with the issue of the pharmacy support personnel, what you refer to as the pharmacist assistant, where we see the role of the pharmacist assistant and pharmacy technician, it's again in primary healthcare. Chair, you would note that we have in public sector plus minus 4,000 facilities. Some do have pharmacy technicians and assistants, and where they are available, they are of importance in terms of the management of pharmaceutical services, and also when it comes to shortages of stock in the clinics and so on. As you would know, nurses are currently inundated with the workload. So ideally, we see pharmacist assistant and pharmacy technician of primary role being at the primary healthcare clinic to assist nurses in terms of the dispensing services and supply chain management. And you asked the number. In terms of the number, Chair, as we speak, we have 24,598 pharmacist assistant. In terms of the pharmacist, we have 18,678 pharmacist assistant chair. So we do have pharmacists. We do have the numbers to be able to offer those services. There was a question that was asked with regard to us wanting to encroach on the scope of Health Profession Council. I think what we were alluding to, Chair, and both at the statutory level, we collaborate with Health Profession Council and Nursing Council. Just yesterday, we were discussing with the two registrars, how do we get our staff vaccinated? And we are leading that aspect to make sure that all the staff for the statutory councils are vaccinated. That's the collaborative approach we use, Chair. When it comes to at the practice level, as a patient gets into a pharmacy, we make sure that if they require medicines, as the president said, we provide for such. Where they require to do blood glucose testing, blood pressure testing, peak flow meter testing, urine analysis, there is always a clinic within the pharmacy. And in most cases, you would have a nurse in there to do those screening services. The further approach, and that's where maybe I might have been misunderstood, is that if a patient is inside that particular pharmacy and the nurse or a primary care drug therapist pharmacist has assessed the patient and they are of the opinion, this patient needs to be seen by a doctor. As part of the one-stop approach, we're saying the patient doesn't have to walk or travel to a doctor. You can use telemedicine using the facilities within the pharmacy, contact the doctor. The doctor can, via the telemedicine, do his or her job, diagnose the patient, and be able to prescribe the necessary treatment. So that is one-stop approach. And I think that's why we're talking about universal healthcare approach, is to get to a point where the patients don't have to run all over the show to get treatment. But if they do visit a healthcare professional, they must be able to get their treatment. There was an issue raised to say, what are pharmacists doing as part of primary healthcare services? We have, as the president has cited, that we have people we refer to after qualifying, they go do a 2-year diploma called primary care drug therapy. They are able to prescribe 3 and 4 medicines. They get the permit issued by Director General as part of primary healthcare services. They mainly look at minor ailments like tonsillitis, and also continue with the services with regard to management of chronic medicines. The latest that the council has been busy with is the pharmacist initiated antiretroviral treatment. So that's part of expanding and making sure that patients do get medicines insofar as the treatment of the HIV/AIDS treatment. So that's what we're doing. The other thing that pharmacists are doing is immunization, Chair. That we've been at the forefront, and I'm sure you are aware that most provinces are now contracting pharmacists to assist with immunization. The other part of the work we do is family planning, so that the mothers, when they come and bring their children for immunization, they might so much so get the family planning and be assisted within pharmacy. So those are the aspects that we believe pharmacy is part and parcel of the primary healthcare approach. And Chair, if I could emphasize, there was a member who raised the issue to say, why do we exclusively want pharmacy to be listed in there? If you check currently the bill as published, there is a part where it says, and I read, this is how the bill reads currently. In the private healthcare sector is the general practitioner, primary care nursing, primary care dental professional, and primary allied professional. So the other professionals are specifically mentioned in the bill. That is why we are saying we want pharmacists to be included in the bill. They should not be clumped, because when we asked, we were told no, they are primary allied healthcare professionals. Pharmacists are not that. And the pharmacy itself, Chair. So that's why we believe that it is important that when the bill is published, that omission is corrected, because we believe it was an omission, Chair, that probably was left out. And I think it will be complete the bill if it was to be done as such. Chair, there was an issue with regard to purchasing and all that. Currently, Chair, we are aware that even in the current dispensation, government is doing the procurement insofar as medicines is concerned for public sector hospitals, and private sector is doing the same. We also are aware that when it comes to the pricing, because of the volumes of what government procure in comparison to the private sector, there is disparity. So NHI will also bring equity in terms of the pricing of medicines, that the same thing that is bought in public sector for 10 rand, it's bought in public sector for 100 rand. So we think that needs to be corrected, Chair. So that is why we support the whole approach with regard to universal healthcare approach. I think, Chair, we've covered most of the issues that were said. There was an issue to say specifically in the Medicines Act, what is it that we are bringing that should be changed? There is a definition in the Medicine Act, I think it's section 22A, 17 and 14, where it talks about an authorized prescriber. You will also notice in the Medicines Act, when it talks about authorized prescriber, there's an exclusion of the pharmacist. So we are of the opinion that as the bill is being processed, there is a need to amend Medicines Act to reflect that pharmacists will also form part of authorized prescriber. So that's what the main thing that we are asking, that as you process the bill, please, we could ask that the section 22A14 and section 22A17 be amended to include pharmacists as part and parcel of authorized prescriber. And pharmacists are already doing it, except that they are currently doing it using the section 22A15. So we are of the opinion, if that is amended, there's no need for permits to be issued all the time. At the point pharmacists have done the necessary qualification to be able to prescribe.
Thank you, Nderetla. There is one point which I think we missed. There was a question about the number of pharmacists which we represent. So I just wanted to clarify that part to say that we actually do not represent pharmacists, but we register all pharmacists in the country. In fact, if a person with a BPharm degree is not registered with Pharmacy Council, such a person cannot call himself or herself a pharmacist, because if you only become a pharmacist upon registration with the South African Pharmacy Council. So regardless of you holding the degree. So all pharmacists in the country are registered with us for them to practice. So I just wanted to clarify that question of the number of pharmacists that we represent. I thank you. Memkwena, is there any comment from your end on the questions?
Thanks, President. And maybe just to add a little bit, oh, my video is not working. Just to add a little bit on the numbers, maybe if I can just provide, though, is the numbers on our register. We have just about 16,500 pharmacists. We have 18,000 pharmacy support personnel. I have excluded the students that would be on first, second, third, and fourth year interns and interns, because we keep those registers as we monitor the production from the time a person registers as a pharmacy student and again as a learner. So those are the numbers that are required. Maybe just to also add, because the president and the registrar covered the work that is already being done, but from the office side, we are also preparing on the expansion, wherein we are engaging the accredited providers, because they are our key stakeholders, to ensure that we increase on the training so that when we get to the point of NHI, we are ready as a profession. For that reason, we have also looked at revising the mission of South African Pharmacy Council, which was done with the inception of the new council, wherein universal health coverage was elevated to ensure that the work that we do on a daily basis our eyes are on ensuring that we do support and we're able to participate in the achievement of NHI. Safe to say that with the cadre that we are providing, that we are supporting, or those that we have published the regulations for the pharmacy technician, our eyes were on an ideal clinic to say we would want to see us achieving maybe 100%. I know it's being ambitious, but we believe that it can be done with the right support of the human capital. Thank you very much. Thanks.
Okay. No, thank you very much to your responses. I'm really delighted with your response, especially on what I was checking, boss. You then became at a particular time in the country sensitive to rural provinces and to rurality of certain clinics, that at least a support of a primary healthcare trained nurse by a pharmacy assistant will be of greatly appreciated. And so that is felt down there. And I think, please don't stop that program, whatever happens. It is really, and now I'm learning something, pharmacy technician. But all what we are trying to do is to augment, and you are correct. You need to advise a patient, while someone who's much more competent than me can be able to put tetracycline in a packet and pack for you, not any other person. So they play a critical role in that regard. Honorable members, that was a presentation and the response of the Pharmacy Council.
I raised my hand and I also typed in the group because my second question was not answered. I requested to make a follow-up. I even typed in the screen.
Which question is that?
Can I be allowed to do that, Honorable Chair?
Yeah, which question is that? Bring it up.
The one, yeah, thank you very much. I'm saying that, remember, Honorable Chairperson, the context is that they are allowed to diagnose, prescribe, and dispense. The question was that why there's an input of Pharmacy Council regulating medical practitioners for practicing telemedicine in their pharmacies. What is therefore the role of the HPCA in the instances? Because this is encroachment. The other regulatory authority has given that mandate and they want to duplicate that mandate. And yet themselves, they are allowed to diagnose, prescribe, and dispense.
Yeah, they answered that question. I don't know whether you had logged out at the time they answered. If then they can bring a response again.
They failed to clarify on these two mandates, which when Mr. Tlala was responding, I was here. He missed to be able to respond to this one. He was speaking on other elements, diving from the specific question that I've asked. Can be allowed to clarify, please.
All right, Chair. Should I attempt to answer on this one?
Go ahead.
Great. I think the honorable member, perhaps, because I did talk to this, I said the telemedicine part, we are not regulating it. All what Mr. Tlala was saying was to say, in expansion of the scope or the role that pharmacists play, even within the pharmacy, you will find an extension of the service going to as far as telemedicine in the clinic. So it is, which is a new addition that has happened. Pharmacists right now in their pharmacies, they are having clinics, and in those clinics, over and above the nurse performing specific duties in there, the nurse is able to also link up, due to the availability of technology, with the doctor who is sitting in his practice elsewhere to ensure that they advise the patient. So there are a lot of doctors who subscribe to this service in pharmacies. They extend their work to pharmacies by doing that. So that is it was an explanation to say that in talking about the scope that or the role that the pharmacies are playing, right now, it is no longer limited to primary health care, but even complicated disease states can be looked at through the telemedicine. So I think that is where we mentioned the telemedicine part of it, and that has really nothing to do with us as Pharmacy Council. We only regulate the pharmacy itself and how it works. But the telemedicine part is an addition that the doctor remains to be under the Health Professions Council, even when they are practicing in that format of the telemedicine. They are still answerable to the Health Professions Council, not to the Pharmacist Council. Thank you.
Okay. Then that was the last clarity that was brought in. We thank you, President Pasha and the CEO Tlala, for your engagement with the Portfolio Committee on this matter. We are processing this bill sponsored by the Department of Health, and we will find space and time to engage with the department in as far as some of the issues that you have raised in this, because they are documented, they are part of us on that. You just finished on time, 11:05, even though we giving you more time than you did. So it means the discussion was quite involving. I'm informed that we will start at 11:25. Honorable members, with the new presentation from the Health Professions Council of South Africa. Thank you very much, President Pasha, and your team that you led. Thanks for Ms. Mkwena was part of you. We can then release you now. Thanks.
Thank you very much, Chairperson.
Thank you, Chair, and goodbye.
Right.
Thank you and goodbye.
Yeah. Ms. Kwahube, let's reconvene at 11:20. Get to at least come in 5 minutes before their starting time. Thanks.
Okay, thanks, Chair.
Say Ms. Kwahube or Ms. Majalamba.